Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so happy to have as our guest, Dr. Udaya Thomas. Udaya is an integrative nurse practitioner at Memorial Primary Care in Hollywood, Florida. She has completed her PhD in nursing, Interdisciplinary Health with a focus on health psychology. Her dissertation was specifically focused on the effect of mindfulness meditation in groups of patients with anxiety compared to usual integrative behavioral health in primary care. Udaya has been an IM4US volunteer for 7 years and is also the past president of that group, which stands for Integrative Healthcare and the Underserved, for the Underserved. So thank you so much for joining us today.
Oh, you're welcome, Ellen. It's so great to be here with you. Thank you.
So, it was really years ago that we met at a dinner where you and I happened to be sitting next to each other at a yearly holistic nurses dinner.
That's right.
And I was absolutely fascinated to meet you from the first minute, and also really excited to meet you, because my whole dream about any kind of accomplishment at this part of my life, after doing this for almost 60 years, is really to see evidence-based integrative medicine become standard of practice. And it seems to me that you have actually done that, although you feel like perhaps not enough, but you have brought that into a mainstream setting somewhat successfully.
Well, thank you, Ellen, for your generous introduction and your words. It was actually quite an honor to meet you and talk with you. And yeah, I think, it's a work in progress. Mm-hmm. But I have made some strides in a traditional mainstream health system model.
Yeah, that is big. And I know you have worked also as a social worker, as well as a nurse and a researcher, and also a public health officer. Tell us about your role as an international public health officer.
Well, it sounds from that list that I'm a bit scattered, but the journey has been somewhat intertwined and very purposeful and intentional along the way. My work as a public health officer was with an international NGO that focused on maternal child health, infection prevention, standards of quality of care across many different countries around the world. And so I was involved in the sense that I was a trainer and a clinical advisor, as well as a program officer. I had a few different hats in that organization. The organization is called JHPIGO, JHPIEGO. They sometimes, you might have heard them recently on NPR, actually. There's been some more sort of promotion about the work that they do worldwide. But I was with them for about 6.5 years. And that was my role, basically, was sharing the latest evidence-based medicine in public health with countries that don't necessarily have the access to the technology and research that we have, and empowering and giving the tools to local clinicians and professors to strengthen their country's health systems and education systems.
So being someone who is so, let's say, diverse culturally, as well as personally in the many places that you've lived and interacted, in a situation like that, both in other countries as well as here, what has been your experience in terms of the healthcare people who are delivering healthcare being interested in, let's say, the natural therapeutics or folkloric therapeutics that are already practiced culturally by those people who live there?
That's an interesting question, Ellen. I think it's just part of life. I don't think it's separated so much. I think our, Western minds, or those of us who have immigrated here and become more Westernized in our thought, think about indigenous care and traditional medicine maybe in a different way than people, who just live in it and are from it. So, there might not be necessarily a dichotomy as such in their minds, but things that they do at home to support their health and well-being versus what they might actually go to a medical provider for.
And so that's an interesting concept that comes to our word integrative, because I really think integrative medicine, when that word's used correctly, really can express the best of medicine, where there's no reason that people who use certain traditional and folkloric techniques, be they herbal or food or prayer or drumming or any other specific technique that might be linked to healing in their culture, has to be told that, oh, that's all hogwash and that's all not real. When we look at things in an evidence-based way, we find out not only can they be helpful, sometimes they lead to a shorter disease course. Sometimes they actually help with things like pharmaceutical absorption when we measure it. So that's what I think really integrative can be, which leads to best care.
Absolutely, Ellen. The way you worded that was just perfect, because I think part of, the central part of integrative medicine is listening deeply to yourself and your surroundings. So once you tap into that awareness of who you are and who you're connected to and the community around you, then you're more aware of actually what's happening physiologically, socially, globally, and how that impacts your health. And whether that's, your physical manifestations of health, accidents, or even how health sort of manifests or disease or dis-ease manifests in your body, or how you interact with the world mentally or emotionally. So it's not, in the US, we tend to silo the different parts of the body, and we tend to look at the different parts of the body separately versus together as a whole person. And integrative medicine, that term came around, I think, nicely, because it's integrating for a whole health perspective and a whole health orientation to health and well-being.
Yeah, I think it's a great term also. And I'd like to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse. And today, my guest is Dr. Udaya Thomas, who is a PhD and an advanced practice nurse practitioner. And one thing you really wanted to share today, I know, is the topic, since we talked about integrative, of integrative healthcare for the underserved. And I was so attracted to that. You're the person who actually introduced me to the fact that there's even such an organization, which I have become a member of, because for the years and years that I worked in integrative medicine, for instance, I worked at a clinic for 23 years in Manhattan called the Corsello Center for Complementary Medicine. And we saw absolutely astounding, what I'll say are cures for thousands of patients who were told they have a disease they're going to have the rest of their life. Yeah, until they changed their diet and lifestyle. And then miraculously it went away. But the only people who could come there, truthfully, were not the underserved. They were, in fact, really wealthy people, because so many of the interventions we did were totally not covered by health insurance. So you had to have like deep pockets. And that always bothered me, which is why we started doing radio shows, because that's accessible to anyone.
Absolutely.
So tell us about this group.
Yeah. Well, first, I think it's wonderful that you're doing this. I've been, listening to the podcast. I've learned so much from it. And it's really an honor to be here, because you just have had amazing guests, world-renowned folks on your radio station and your program with Dr. Z. So I want to appreciate both of you for all that you've done for many years for the community, and sharing the wisdom and knowledge behind integrative health and medicine. Now, I want to highlight a couple of terms that you pulled out. One is integrative health, and that's actually how we like to see the organization, as an integrative health organization for the underserved. And underserved is another term that, it seems like you're serving somebody, it's a handout, and I actually prefer the term under-resourced, because I think that gets at the heart of what's happening. And so the organization is affectionately called I Am For Us. So integrative medicine for the underserved. It has a really nice ring to it. So it hasn't been changed, although there has been a lot of discussion about these terms, philosophically, how we use these terms, and how, terms and words can be very powerful. So we want to be cognizant in our conversations about the organization and about the work that I Am For Us does, how that really translates into, person care at the community level.
And I know that you've been having sort of ongoing conventions, and even with this year, without having conferences in person, you still went ahead and had it, and it was very well attended.
Yeah, actually, the last 2 years have been virtual conferences, and the previous years have all been in person. I Am For Us was actually started by a group of docs, that were met at Society of Teachers Family Medicine Conference. And they created initially like a special interest group, started having monthly conference calls, and then they had their first conference. And they expected about 50 people, but they had like standing room only. So they felt like, oh my goodness, a movement was born, And so there are lots of practitioners, and they're not just medical practitioners, MDs or DOs, but other practitioners who work in communities that were interested, like how do we not only, offer sort of integrative health and medicine sort of advice or resources to our communities that may not be able to access them, like the community you talked about in New York, but also how can they become involved? And so the organization grew into a really multidisciplinary group, which was initially 100%, MDs and DOs, is now only 25% physicians. So that really shows you sort of the growth, over the years and the transformation that's happened.
So when you came on board, the organization was already served, but you actually stepped forward and volunteered for 7 years, but then you became the president of the organization, which is a huge responsibility in terms of time and work.
Yeah, it was, especially in the middle of a PhD. But, I sort of follow, when you're called to do something like duty calls kind of thing, it wasn't something that I wanted to do or I ran for, nothing like that. It was, something that was needed at the time. The leadership was needed. And, there are some board members, terming off and some new ones coming on. So it was a role that was a pretty big role to fill. I'm only the fourth official president of the organization, and we have always had a very small staff. So hopefully, as the organization grows, we'll be able to add more staff as well. And this past year, it's almost been a year now. We've had our very first full-time executive director. So that's been immensely helpful. Her name is Heather Carey, and she's really stepped in. She's been a member for a long time too. My trajectory was actually around similar time since Heather's been a member. And so we actually met in a policy committee. She was involved with a policy committee and policy and advocacy committee working group. So there's all these different committees in IAMFRS that you can get involved in. So I was really involved in that committee. And then the chair of that committee at that time, Sherrod Coley, a bit of a mentor to me as well. He was one of the founders of IAMFRS, and he kind of encouraged me to become the chair. And I said, well, Sherrod, how about we have co-chairs? So I jumped into that. That was also during the beginnings of my PhD program. And then, I was invited to be on the board, and then, invited to be president. So it's been sort of a gradual, progress or process of leadership that I've had with the organization, but it has been my immense honor to be in that role. And when we didn't have a full-time staff, yes, it was a lot more work than it has been this past year.
Well, let's talk about some of the themes and the focus, and also telling our listeners you can always come on board at Herbally Yours, and we will have a live link to where you can find out more, and that's at IM and then the number 4 US.org, and we'll have that as a live link. But what does decolonizing medicine mean?
So that is that's a term that really looking at the existing health system and structures and the way that medicine operates in this country, and finding ways to take away some of the barriers and hurdles that patients, may encounter in navigating the system, and infusing Indigenous care that we were talking about, that, many patients come to the system with that knowledge and that heritage of what works for them, or what, partially works for them, but maybe not fully. So, but having that accepted in the mainstream system. And that is a huge task, because the health systems may not necessarily be acceptive of decolonizing Western medicine per se. So we have traditional medicine and Western medicine, right? And so traditional medicine sort of refers to all sort of Indigenous care, and maybe shouldn't be lumped that way, because it's very diverse, ways of being in different cultures. But that's the idea around decolonizing medicine, is creating more access. And then re-indigenizing is another term, but
I never heard of that one. What does that mean? Re-indigenizing. Never heard that term.
Yeah. So re-indigenizing is, you look at the diversity of this country and you realize how many different cultural heritages we have, different ethnicities and different ways of being that we can appreciate, learn from, and, respect. And so when a patient comes to us from a different culture, how are we looking at their culture and them as a person, within that perspective, of their journey. Now, we should always look at it as a person and not necessarily their culture. So you've always got to ask the right questions, right? And be really respectful, because when you make assumptions that like, oh, this person has, this person is from, I'll give an example from my practice. This person is from Cuba, so they must eat, X, Y, and Z, and then the person tells you that they're vegan and you're like, what? So,
right.
So you don't want to make, assumptions that someone from, a particular culture is, vegan or not vegan, or you're from India and you're automatically, vegetarian, and that may not be the case. You may be from a Christian background that, that does partake in, eating animal products. So, it's re-indigenizing care, could happen at a micro level at like a community health center that is, focused on food from that culture as part of the medicine, and looking at what foods do they eat or herbs, and how those can be emphasized to improve the health of that person. Or it could be certain practices that they have culturally that help them in their spiritual and mental health, and, giving that opportunity for people to be involved in their care, in their community. So it could have various different levels. And the last conference was just amazing because we had exemplars from all over the country. And we actually had 9 countries represented as well at the conference.
So give us like one very kind of on-ground example of how that might work.
Of re-indigenizing care?
Right. Even, like with one individual, like you brought up, let's say a Cuban person or an Indian person from India versus a native person from a culture in the United States.
Okay. So, for example, personal examples, I have many.
I'm sure.
Because my patients are, I practice in Southeast Florida and Hollywood, and they're from all over the world. So the first things that I ask them are, where are you originally from? Where do you live? What do you do for work? And so I get a little snapshot of, who they are, but then I ask them, more questions and, what do you eat? Can you tell me what you ate in the last 24 hours or the last 3 days? And so they start telling me, and that gives me a better picture of, who they are in terms of the food that they take in. And then, as their concerns come up, then you take a look at sort of all their social determinants of health, where they work, what they do, what they eat, who they interact with, and you get a better picture. And it doesn't happen necessarily in one visit, but it happens, over time as you start to see them, and you focus on, what is available to them and what makes sense to them culturally. And so you are, in a very small way, re-indigenizing that care. Now, I'm, in a very large health system. So, there are other exemplars where people have built community health models that really completely wrap different types of indigenous care into the practice, like bringing acupuncture into the clinic, having an herbalist or nutritionist on site who's working with the patients and their preferences, or in groups. And that's another way to re-indigenize care, is to actually have available. I mean, now in this time of COVID, a lot of groups have gone to telehealth groups or mixed groups.
Right. Well, that's interesting, isn't it? That holds, unfortunately, will be ending soon. But really, I think telehealth has expanded care access quite a bit.
Absolutely. Yeah. And so it's, that also makes it more affordable. So, in many indigenous cultures, the circle is very important. The circle is important to energy, to knowledge, because peers are in a group and they can learn from each other and share with each other. And that in itself is re-indigenizing care, right? Because in the Western model, it's very individually based. It's personalized medicine. It's, looking at your genetics and all of that very specifically. But, the social determinants of health can affect up to 80% of your health outcomes. So your social and built environment and what your behaviors are and how you eat and the access you have to food has such a much larger impact on your health outcomes than genetics, which is maybe 30%, and the actual medical care that you seek, which could be as little as 10%, maybe up to 20%. So this re-indigenizing care is extremely important. And groups and that group model, whether it's in person or hybrid or telehealth, gathering more than, 4 people together, like a group of 8 or a group of 10, can really maximize, how a person feels, the energy that's felt in the room. You can share knowledge. You can, with each other, the provider can actually impart knowledge to a group versus one at a time, which is efficient.
Right. Well, you know what? I just have to tell you that we're going to end there, but it was really such a different model. I'm sure not most people, they just go to the doctor. The doctor's with them about 5 minutes, if that, and then they write a drug, and that's it. Nothing like what you're talking about, the complexity and the honoring of the individual and understanding the cultural reference from where they're coming. So to me, that is very exciting. So I want to thank you so much for being our guest, Dr. Udaya Thomas.
Thank you so much, Dr. Ellen Kamhi.
And thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us again next week for another edition of Herbally Yours. Until then, stay healthy.